For all of your facial rejuvenation consults, you use 3D imaging.
We use 3D imaging for a whole host of patients in our practice. Whether you're interested in better skin, whether you're interested in a filler, whether you're interested in a facelift, nose shaping, chin augmentation, neck liposuction, breast aug, breast lift, the 3D imager allows you insight into what the future holds for you.
How does it work? How does it work?
It's a great system. It's a Vectra 3D system. It has 6 cameras and strobes. They all fire simultaneously. The computer then generates a 3-dimensional model. We're able to move the camera around.
You can show them their face at all angles.
Every angle. We can rotate it so you can look up, you can look down, and look from behind. It's really cool.
Okay.
And it's so powerful because for instance, if you're interested in a breast augmentation and you say, you know what, there's 120 different types of breast implants, show them to me. I can dial it in, I can show you every single one of them. Big, small, teardrop shape, round, high profile, low profile, textured, smooth, saline, silicone. It's really that neat. And for facial rejuvenation and nose shaping, it is a new standard in how we conduct plastic surgery, because you otherwise, when you're commissioning art, and I do consider this art, you have no idea what you're buying or
like what it's going to look like.
What it's going to look like. So we give you a glimpse as to what my vision is, and hopefully what your vision is.
So like on a nasal surgery, rhinoplasty, or a facelift, you can show them predictably, this is what you're going to look like.
Yes, absolutely.
Is that right?
Yeah, and more importantly, I get the patient's input. I like to look at it and show them an example and say, now, what do you think of that? And if they say, you know what, I want the dorsum down a little more of the hump off.
Wow.
I want the tip up, show me with a little skinnier tip. It allows them control over their result. And once I have that dialed in, there's another little part of that that shows me, okay, take 3 millimeters off the back, raise the tip 2 millimeters, bring the chin out 6 millimeters.
Wow.
And then I can go into surgery and recreate those little steps.
Now, when we talked on the telephone, my first impression was it was gimmicky. You say this is like a $30,000 or $40,000 machine, and now that you use it, you couldn't do it any other way. That's what you told me.
You know, I had my trepidation when I was looking at the machine way back. I've had it now almost 6 years. We were the first one in San Diego, and I got it in there, and my biggest fear was that it was going to be a $35,000 coat hanger in my room.
Okay.
But I can't live without it anymore. It has raised the standard in our practice by so much, and it has helped the patients lower their anxiety, lower their trepidation about any procedures, because they know what they're going to look like.
So when they're sitting there, do they say, I want that?
I want that.
Don't go any further. Is that right?
You know what's really neat? We'll put the breast augmentation implants in there, and they'll say, show me what it looks like in a bikini. Boom, we put a bikini.
Wow.
Show me what it looks like in a sports top. Boom. Blue's not my favorite color. Okay, pink. Boom. Leopard. Boom. It's really neat. We have a lot of different options available, and I can't live without it right now.